so much for joining the NeedyMeds special topic webinar, the PAN Foundation, Connecting Underinsured Patients with the Treatment They Need. My name is Carla. I'm the Director of Education and Partnerships at NeedyMeds. And before we get started, I'd like to go over a few tips so you can make the most out of today's presentation. You can feel free to ask questions by typing them into the questions section of your GoToWebinar control panel. Just know we will reserve answering questions until the end. If we don't have the time to answer your question, we'll follow up with you by email. I will provide the contact information for NeedyMeds and the PAN Foundation at the end of the webinar. Also, this webinar is being recorded and will be available for viewing on the NeedyMeds YouTube channel. And you can find our PowerPoint slide decks as well as other reading material in the handout section of your control panel. So let's get started with what is NeedyMeds. What you're looking at is our mission statement, our vision statement, and a statement about how we achieved our mission. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do this free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. I always like to put up a screenshot of our homepage because our website is the face of our organization, and it gives me the chance to point out a few resources. If you're interested in locating healthcare savings resources, check out the Patient Savings tab. To stay up to date on what's new at NeedyMeds, check out the Advocates tab. This is where you can sign up to receive webinar announcements, our monthly newsletter, which is called Vitals, and order brochures. In the beginning, I mentioned this webinar is being recorded and that you can find it on our YouTube channel. You can find a link to that on the top right hand of our website with the rest of the social media icons. You can also find other upcoming webinars on the bottom right-hand side calendar of events. Now, as you saw in a few slides ago, a big part of our mission is education. And we define that in two ways. One, by educating people about NeedyMeds and the resources we offer, but also by letting them know of other resources that will help them afford their healthcare expenses, which is why we are so pleased to have our guests, Audrey and Joan, here with us today from the PAN Foundation. So first, let me tell you just a little bit about the PAN Foundation. They help underinsured people with life-threatening, chronic, and rare diseases get the medications and treatment they need by paying for their out-of-pocket costs and advocating for improved access and affordability. So now, let me tell you a little bit about our guest hosts, Audrey Cordy and Joan Zhang. Audrey is the Senior Manager of Provider Relations and helps to develop and implement PAN's provider outreach strategy. She has over 10 years of experience in the healthcare industry, focusing on insurance coverage, reimbursement, and access to care programs. She holds a Bachelor of Science degree in Business Marketing from Syracuse University. Joan Zhang is the Manager of Medical Affairs at PAN and reviews the clinical parameters of PAN's assistance programs and conducts outreach to pharmacies and related professional groups. She's a licensed pharmacist with a Doctor of Pharmacy degree from Shenandoah University, Bernard J. Dunn School of Pharmacy. So without further ado, and hopefully seamlessly, I'm going to go ahead and pass the mic and the screen to Joan. So bear with me while I do that, and hopefully we'll do that seamlessly. Now, that will take just a moment. And I see Joan already pulled up that screen, so I will let Joan take it away. But first, I will remind everybody again, if you do have questions, you can go ahead and type them into that questions section of your GoToWebinar control panel. Thanks so much and enjoy the presentation.
Thank you, Carla, for that wonderful introduction. Hi, everyone, and thank you for joining us today for today's webinar about the PAN Foundation. We understand that there's a lot going on in the world right now, especially with COVID-19, and so we are extremely glad that you're able to take some time out of your day to join us. My name is Joan. I am the Manager of Medical Affairs at PAN, and today I'm joined by my colleague, Audrey Corte, our Senior Manager of Provider Relations. This is our roadmap for today. We're going to walk you through what we do, why we do it, and how you can apply and begin receiving assistance with PAN. We know that today there's going to be a lot of information discussed, and so it may be difficult to absorb all of it at once, but we do encourage you to please send us your questions as we are going along in this presentation. And as Carla said, this webinar will be recorded and hopefully you will be able to review it again at a later date. So first, let's start with why copay assistance is important. So as you may already know, access to treatment that is medically necessary is super critical for successful patient outcomes. However, this access is often blocked by high cost sharing, which then can impact your quality of life and the course of a disease negatively. High cost sharing it relates to any healthcare expense that is not covered by the patient's insurance plan and therefore must be paid by the patient out of pocket. And these out-of-pocket costs can come in the form of deductibles, copays, or coinsurance. Patients who have insurance but then are unfortunately not able to afford their out-of-pocket costs associated with the treatments that they need are then considered underinsured. A recent study by the Kaiser Family Foundation reported that on average, Medicare beneficiaries spend around 41% of their Social Security payments on these out-of-pocket costs. And unfortunately, they expect that that number will rise to 50% by the year 2030. In addition, between 25 and 30 million people were underinsured in 2019 in the United States. And that number for underinsured population is expected to grow even larger this year, which then creates an even bigger gap in this population. For many of these patients with chronic, rare, or life-threatening diseases, this cost of care can add up super quickly, which then puts these patients in that underinsured population. In 2019, Chagall Research conducted a survey to assess PAN's patient satisfaction and our perception of services provided to the patients that are currently receiving financial assistance with us. They reported that after receiving assistance from PAN, an estimated 94% of the patients responded that the support from PAN was able to make them more likely to take their medications as prescribed, and then had a positive impact on their families. Likewise, 92% reported that the support from PAN really helped improve their quality of life and decrease stress for the whole family. This research is super critical, and it shows that a true need for support from these patient assistance foundations is really out there. It's super needed for this underinsured population. The Patient Access Network Foundation believes that out-of-pocket costs should not prevent anyone from obtaining the medically necessary treatment that they are prescribed. And so today we are going to tell you more about how PAN can help remove these financial barriers and then alleviate the high out-of-pocket costs for the underinsured population. So with that, I'll turn it over to Audrey, who will tell you more.
Thank you, Joan, and hello, everyone. Let me begin by telling you who we are and how to apply for assistance with the PAN Foundation. The PAN Foundation is a nonprofit organization that is dedicated to helping federally and commercially insured patients pay the out-of-pocket costs for their prescribed medication. So since its founding in 2004, PAN has provided assistance to nearly 1 million underinsured patients with over $3 billion in financial assistance. We have three types of assistance programs. First, we have the Medication Assistance Program. Then we have the Health Insurance Premium Program. then we have the transportation or travel program. So the Medication Assistance Program assists patients to pay their co-pays, deductibles, and co-insurance, while the Health Insurance Premium Assistance Program assists patients to pay their insurance premium for either the secondary or the primary insurance. And then finally, we have the Travel Assistance Program, which helps to cover the cost of approved transportation, lodging, and other travel expenses incurred from the patient's treatment. All these programs that we provide all these programs and assistance that we provide is in the form of financial grants. Later in the fall, we do plan on providing more assistance for the Travel Assistance Program. Currently, our Medication Assistance Program is the largest program that we have at PAN, with over 90% of our assistance program falling in this category. But later this fall, we plan on introducing and launching the travel program, which you need to probably stay tuned for, as we'll tell you more as we get closer to that time. So PAN provides and offers assistance for nearly 70 assistance programs, and they range from chronic to rare to oncology diseases. We recently added the pancreatic cancer and bipolar disorder to our list of disease funds and launched the COVID-19 Financial Support Fund. This support program for the COVID-19 is unlike any of our other disease funds because it covers a range of services, which includes over-the-counter and prescription medications, medical supplies and equipment, and transportation to medical or pharmacy appointments, as well as groceries and meal deliveries. To see a full listing of all our assistance programs, please visit our website at panfoundation.org. So a common question we get at PAN is what we cover and what we do not cover. So at PAN, we cover all FDA-approved medications that are listed in official compendia or evidence-based or clinical guidelines. And this includes brand and generic medications, bioequivalent or biosimilar medication, specialty drugs, as well as radiopharmaceuticals. But just as it's important to note what we do cover, it's also important to let you know what we don't cover, as we often get claims for products or services that we do not cover. So at PAN, we are diagnosis specific, so each disease fund that we have has a list of formulary drugs that are covered under that particular diagnosis. So we don't cover any product that is not on our list of formulary. Although there is an exception to this rule, if you do see a medication that is indicated for a particular disease state and is not listed on our list of formulary, please reach out to us. You can find a contact information or send us information on our website under Get Help or Medications, Find a Medication, and you can send us a note to let us know that you would like for us to consider covering this particular product. We'll review it and get back to you in about 7 days to let you know if it should be covered or if we were not able to sustain that it should be covered under a specific disease fund. In addition to that, we also don't cover products that are covered at 100% by the insurance or that the insurance company did not cover at all. We also do not cover products that are billed 100% to the patients or that are billed to the patient's discount card instead of an actual insurance card, as well as office visit and lab work and medical services as such. So our PAN, our grants provide 100% assistance support for most of our patients. So we look at historic data as well as industry trends to determine how much a patient is going to need for a specific disease fund, and we allocate that certain dollar amount to that fund. we just try to make sure that throughout the year we review this funding to make sure that there is enough funding available for the patient. What we do have, however, is because we do see that there are some patients that sometimes fall into this an outlier category where they require more funding. And so for those few patients, we do have additional assistance program called Second Grants. And it is available to all our patients. But say you run out of funding in the middle of your eligibility period, you can apply for a second grant at PAN, and we'll provide the same amount to you, and you'll be able to use that towards the rest of your eligibility period. And as we continually review throughout the year, we also make sure that the claims that we're receiving is also matching the assistance that we're providing. So we continuously look at reviewing the amount to make sure that we are providing adequate amount to support our patients. So I would like to spend the next few slides focusing on how to apply for assistance with PAN. So there are 4 easy steps to apply for assistance with the PAN Foundation. The first step is to check to see if the disease fund is open. Second, we'd like for you to verify the program's eligibility criteria is met. And third, we'd like for you to gather all the required information. And then finally, you are ready to submit your application to PAN. So let's go ahead and take each step and go a little bit deeper into it to explain what you will do at each and every one of those steps. Step 1, check to see if the disease fund is open. You can do this in 3 ways. First, you can go to PAN website at panfoundation.org, and you can find out if the disease fund is open or not under Find a Disease Fund. Or you can go on any one of our 3 self-service portals. So you can go on our patient portal at panapply.org, or you can go on our pharmacy portal at pharmacyportal.panfoundation.org, or you can go on our provider portal on our providerportal.panfoundation.org. Each and every one of these portals is designed with the end user group in mind. So for the patient portal, either the patient or caregiver can go on this portal to enroll a patient, and the pharmacy portal, likewise for the pharmacy staff, and also for the provider portal for the healthcare provider staff to be able to enroll their patient and manage their accounts. A third way that you can check to see if a disease fund is open is also to call us, and the number is 866-316-7263. We're open Monday through Friday, 9 a.m. to 7 p.m. Eastern Time. So the second step is to verify to see if the patient meets the eligibility criteria for which you are applying, for the disease state for which you are applying. So these are general eligibility guidelines for all our disease funds, but each and every one of our disease funds have specific guidelines. So it is important to, even though this is a general overview, to make sure to check on our website to verify the eligibility criteria before you apply for that assistance. And so this first requirement that we have for our grants is to be able to be sure that the patient is getting treatment for the disease named in the assistance program that they're applying for. So for instance, if you're applying for the asthma disease fund, we require that the patient has a diagnosis of asthma. This is going to matter more later on when the patient submits claims. And so we want to ensure that the patient does have asthma if you are going to apply to that disease fund. Second, the patient must be seeking assistance for the medication or product listed on our list of covered medication. So in other words, the medication that you or the product that you are looking for assistance for must be listed on our list of covered medications. As I spoke about it earlier, we do have a formulary, and so for that we want to ensure that if you're applying for assistance with us, that the medication is listed on a list of approved drugs that are covered under that disease fund. Next, you want to make sure that you have your health insurance is covering the medication or product that you're seeking assistance for. Now, this particular stage or this particular requirement is different for every disease fund. So it's always important to check first, because for some disease funds, we require is for commercial payers only, and for others, it's also for Medicare patients only. And still, we have others that is also for both. So it's always important to check and make sure the eligibility coincide with what the disease fund requires. And then the next one is the income must fall at or below 400 or 500% of the federal poverty level. Now, this one too is important to check, because sometimes it's 400 and sometimes it's 500. And then finally, the patient must reside and receive treatment in the United States or U.S. territory, although U.S. citizenship is not a requirement. So this brings us to the homepage of our website. And here, patients, caregivers, providers, or pharmacies can check the patient's eligibility for a disease fund right on the main page. So when you go to panfoundation.org homepage, you can see here in the picture on this slide, which is an actual screenshot of our website, you can start right here and by first typing in the medication or the disease fund you're looking for, and then you can, below here, you can indicate whether you're a patient, caregiver, pharmacy, or provider's office. And right here on the second step, you can start checking eligibility for the patient. So you can check right on the website to see if your patient is eligible for a disease fund. And you can even go as far as completing an application right on our website. So this is a great tool that we have provided for you to make it easy for you to apply for assistance at PAN. So this is an example of a disease fund page. So when you go on our website, when you go to panfoundation.org and you go to find a disease fund, and you actually select a disease fund. So let's say in this instance, you selected Fabry's disease. You will land on this page, and this is an actual shot of that particular page on our website. And you see on the upper left-hand corner if the disease fund is open. You will also be able to apply right away. As you can see on the right-hand side, you can start putting in your application information right on our website. And you can see the assistance amount, and in this instance is $7,800 per year, and all the list of eligibility criteria for that disease fund. So, for instance, on this screen, on the under eligibility criteria number 5, it says the patient's income must fall at or below 500% of the poverty level. So right away, you can be sure to know exactly what the poverty level is. It's different for every disease fund, as I was stating, and you can calculate this right on that page to see if your patient falls within that guidelines. In addition to this, you can also see the list of covered medications as indicated here. And if you were to scroll down a little bit further, you can see all the diagnosis codes that are also covered under the disease fund. So step 3 is to gather all the required information and make sure that you're ready to apply for assistance with PAN. So the first information that you will need is the patient's demographics, such as the name, date of birth, etc. The second information is the diagnosis and the medication name. And we want you to have the diagnosis because we want you to be able to enroll in the correct disease fund, as we have many, and so we want to make sure that you're enrolling in the correct one, especially when it comes to submitting claims, so that the claims will be approved. The next one, information that we also would like for you to gather before now you start applying, is the insurance information, because you're going to need that information as well as patient's income and the physician information. Now you're ready to apply for assistance with PAN. So there are 2 main ways to do this. First, you can go to our portals one of our self-service portal, either the patient, the pharmacy, or the provider portal, or you can call PAN at the 866-316-7263 number. In addition to this, either one of these two, I also spoke a little bit earlier about being able to apply for assistance directly on that PAN website as well. So on average, it takes about 6 minutes to complete an application with PAN, and we provide that decision and approval to you instantly. This is important to know that because we make sure that we provide you all of the claims processing information right when you're approved, so you have the information to be able to submit claims immediately. In addition to that, we also make sure that we send that information, your approval information, also to your provider's office, so they too will have it on hand. So if they need to submit claims on your behalf, they will have all that information available. We want the reimbursement process to be simple and quick for you, so we do provide several ways to be able to submit claims to us. There are 3 ways to submit claims to the PAN Foundation, and that is if the patient receives their medication from the pharmacy can bill us directly to PAN, and they can bill us the patient's responsibility, and we'll be able to pay the pharmacy directly. On the other hand, if the patient receives their medication from their doctor's office, the doctor's office can also bill PAN directly on the patient's behalf with the patient responsibility, and we can pay them directly. And finally, last but not least, the patient can bill PAN directly, and what they will need to do is to download the direct member reimbursement form and add with that a prescription label for services received at the pharmacy or an explanation of benefits for services received at the doctor's office. The direct member reimbursement form can be obtained on our website at panfoundation.org under Get Help and Patient, and they will be able to download this information and to be able to send claims, and we'll pay the patient directly. Now that a determination is made as to who will submit the claims, if the patient now decides to submit the claims for PAN to pay them directly, they can go ahead and fax their claims information to 844-726-4728. They can also mail their claims to PAN at PAN Foundation and P.O. Box 2310, Mount Clemens, Michigan 48046. Upon receipt of the claim, PAN will review and process the claim and issue payments within 7 to 10 business days. So now that the patient is enrolled and ready and submitting claims to PAN, there are a few things to consider about the PAN grant. So each PAN grant is for 12 months. And we do provide a 3-month look-back period for new patients coming into PAN. So if you enroll with us today, we'll start you sometime in July to just make sure that you are able to submit any claims that you incurred before calling us. And so if you had claims, say, in August, you'll be able to submit that for payment as well. In addition to this, we also provide this 3-month look-back period for each time that you enroll in a different disease fund at PAN, so that if you had incurred any expenses beforehand, you'll be able to submit that for payment as well. The next piece of information to know about PAN grants is that we do have a grant use policy. And what that grant use policy is that we require that you submit claims to us and get a paid claim every 120 days. So around the 90th day or so, PAN will follow up with you via email or via letter to your provider's office as well as to the patient, letting you know that it's been 90 days and we haven't received any claims. And so we give that opportunity for the patient or the pharmacy or provider to be able to submit claims on behalf of the patient within that next 30 days so that we can keep the grant active. If we don't hear back from you within that 30 days, we will release that fund and make it available to another patient that needs assistance. However, when we reach out to you on the 90th day and you recognize that maybe there's extenuating circumstances that's going to cause you not to be able to submit claims on time, please reach out to us because we take all those extenuating circumstances. We take that into consideration. And also, even after the grant is released, if you find that there is extenuating circumstance as to why you're not able to you're not able to submit the claims, please reach out to us and we'll be more than happy to assist you and take the circumstances into consideration. So another thing to look out for with the PAN grants is that we do have a disease fund wait list. The disease fund wait list is a list of patients waiting to apply for assistance for a closed disease fund. And so what that is when a disease fund is closed at PAN, you can apply on the wait list to go on the wait list. And what that does is that when the disease fund opens in a wait list status, we will notify you and give you a 2-day grace period to apply for assistance at PAN. And then we take another 2 days and we'll make the determination to let you know if you were approved for assistance. Once everyone on the wait list have been serviced, then PAN will open the grant up to the general public, making the grant available to the public. So what the wait list gives the patient's ability is that it provides them an opportunity to be the first to be able to apply for assistance when the PAN grant opens in that wait list status. So it's a good idea that if you are applying for assistance and you find that the disease fund is closed, to put yourself on the wait list so that it kind of works as a placeholder to give you that opportunity, a first opportunity to apply when there's funding available. And then finally, we do have renewals for each grant that you get. So like I said, our grants is for 12 months. However, with a month before the grant ends, so if your grant is, say, ending on December 31st, on December 1st, you are now eligible to start renewing your grant. So our grants are disease funds are first come, first served basis. So whenever there's funding, it goes first come, first served. So it's important that if you are looking for a renewal during that time, to make sure that as soon as you see the disease fund open, to enroll for that renewal and not wait till, say, January 1st to try to apply for assistance, because you do have that month period before that you can start applying for a renewal grant. So we do understand that managing an illness is difficult and that our patients who apply for assistance with PAN may need additional support beyond the financial assistance that we can provide. They may also have questions about their treatment, side effects, and medication adherence. And they may also benefit from connecting with a compassionate community that can help them deal with the physical and emotional complexities of their diseases. And we know that this is not easy, and that is why at PAN, we have formed alliances with the leading advocacy groups, and alliance groups, to be such as the American Lung Association and the National Kidney Foundation, to name a few, to provide patients with the holistic support that they need. So when a patient or caregiver applies at PAN, we give them an option to opt into receiving assistance from one of these alliance partners. And these alliance partners assist patients in many various ways. Some of the ways that they assist them is that they have an extensive educational resources in regards to disease state and make recommendations as to clinical assistance or sometimes even clinical trials. And also they have group and at times one-on-one one-on-one peer support and counseling. So there are so many different avenues and different ways that these alliance partners can assist the patients. And so we make this available when a patient or caregiver apply a PAN, and if the patient or caregiver opts into this assistance, the alliance partner will reach out to them directly to provide the assistance and be able to share with them all the assistance that they provide. In addition, we have joined forces with leading organizations to conduct research and take positions on policies to help our patients. We have an extensive educational resource library to help our patients understand the insurance and the healthcare landscape, and also to be able to answer questions or know the right questions to ask when they go to their doctor's visit. And we also have a lot of writings on advocacy for policy change and so much more. And so we want you to be able to check out this resource information under the Explore Resources page on the PAN website, as these are all ways that we're trying to educate our patients and also trying to provide resources to them that they can use to be able to help them through this journey. I am really excited that I had this opportunity to tell you all about our programs, and I hope that you enroll with PAN to benefit from the many assistance and resources that we have available for our patients. And now I'll turn it back over to Joan, who will tell you more about how to stay connected.
Thank you, Audrey, for walking us through how to receive and apply for assistance at PAN. So like Audrey said, we definitely encourage you to stay connected with us, especially after you're enrolled with PAN. And we understand that you may have a busy schedule, and because of that, we wanted to make our processes quick and simple for you to stay connected. And by having a lot of resources that you can refer to, we hope to reach that goal. So our first recommendation to staying connected with PAN is through our portals. Now, we've mentioned a little bit about our portals earlier, but I do want to go a little bit into more detail as to what you can do on these portals and why it's really our first recommendation to get all of your PAN needs and really make the most out of your PAN grant. So we have 3 portals available. The first is for the patient, and then we have separate portals for the provider and pharmacy. Now, for the most part, these portals are pretty similar, but there are minor details that are different because each portal is designed with the end group in mind. So if you're a patient or a caregiver, you can apply on behalf of your patient at panapply.org. And for providers, you will want to access providerportal.panfoundation.org. And pharmacies will log on to pharmacyportal.panfoundation.org. On all of these 3 portals, you will be able to utilize the following features. You can manage your account, meaning that if you needed to change or edit any of your demographic information, you can do so on this portal. You can also review your eligibility period and grant balance for all of your PAN grants. You can sign up for a second grant, like we discussed earlier, if you are out of funding for that year. And you can renew your grant starting from 1 month before the end of the eligibility period. And lastly, you can review your correspondence letters regarding the account. Now, this is important because a lot of the communication is sent through our letters. So, for example, if you wanted to have a record of how to bill PAN, one of the letters will have your billing information. In addition, we may also send announcements or warnings through these letters if you're about to reach that grant use policy, for example. In addition to these features, we have additional services for our provider and pharmacy portals, such as the ability to communicate with our portal support team via secure messaging, and to review your process claims and run reports as necessary. For our providers, you can also upload and submit your claims on the portal itself. Now, when you're submitting your claims on the portal, it's great to use the secure messaging system with our portal support team if you run into any issues, either with billing or with the portal usability itself. And finally, on the provider and pharmacy portal login pages on the home page, you will see announcements, tips, and updates regarding PAN, our new disease funds, any announcements regarding closures, as well as tips to using the portal. Now, these portals are really important, and we really want to highlight them because it really saves you time by not having to pick up the phone to call PAN if you have a question. Our next resource that we want to highlight is our newsletters. And we have a general PAN newsletter where we discuss anything that's new or upcoming with PAN, including new programs, as well as any events that are lining up, as well as we want to discuss our positions on the United States healthcare environment and on healthcare costs here. In addition to that, we also have the provider and pharmacy newsletters. In these newsletters, we provide information on our programs and if we have any newly added disease funds and medications to our disease funds. We provide tips and guidance on using our services. Now, these could be tips about billing, or it could be tips on using the portals as well. And lastly, this is a great place for to really connect with patients because we provide stories from our patients that use the PAN financial assistance, as well as our call center PAN program representatives. So to sign up, please use the 3 links on the bottom of the screen. Next is Fund Finder. This is a free web-based app produced by the PAN Foundation, and it's the first of its kind app that really tracks all of the disease fund statuses across all of the 9 charitable copay foundations. And all audiences can apply. If you're a patient, if you're a provider, or if you're a pharmacy, you can just go to fundfinder.org, or you can find the link on our website. Once you sign up, you're able to follow any disease fund that these charitable copay foundations offer, and then you will receive notification alerts when a specific fund is opened at any of the foundations. And you can get real-time text either in email or text message forms, depending on what you want to opt into. You can even opt into both if you wanted to receive both methods. So our goal here is to help you save time by not having to frequently check every website for each foundation. And we want to help you to find the support and resources you need so you can spend less time on the manual work and checks. So I really wanted to close this section off about talking about all in all with financial help, our patients are more likely to stay and start treatment. And that's important because it leads to improved clinical outcomes. And it increases the quality of life for the patient and their family. We also see that they're missing less time at work and increases their productivity at work. So I just wanted to close off this presentation really by talking about how important financial help is and that we're really here for your patients. Finally, we know that the PAN Foundation is one of many resources to help patients. And so we encourage you to reach out to us. When you reach out to us, we are able to listen to your needs to really find areas that you need additional assistance with, and then understand how we can help you further. So thank you so much for joining us today, and I'm going to turn it back over to Audrey.
Thank you so much, Joan, and thank you so much, everyone, for joining us today. Amidst everything else that is going on, we appreciate that you took this time to spend with us. To learn more about the PAN Foundation and our programs, you can call us at 866-316-7263, Monday through Friday, 9 a.m. to 7 p.m. Eastern Time. In addition, all the information that we provided you and more is also available on our website at panfoundation.org, and that is PAN foundation.org. You may also reach out to me or to Joan, and our email address is mine is acorte@panfoundation.org, and Joan's is jzang@panfoundation.org. We look forward to working with you soon. And again, thank you so much for your time today. And I'll go ahead and turn it back over to Carla now, who will lead our question and answer section.
As always, a big thank you to both Audrey and Joan for that fantastic presentation. And many of our NeedyMeds users may have already realized that we welcome the PAN Foundation to come back to do presentations several times a year. And the reason we do that is because the PAN Foundation is ever improving and expanding. They're constantly perfecting their portals and ways to connect with their patients. And also, as evidenced by what Audrey and Joan shared during this presentation, also adding to their disease funds. They do an exceptional job with taking feedback that they get from the people that are active with PAN and use their resources to respond to them to see what they can do to improve the process. And no matter how many times I hear it, I can't believe that the average application process only takes roughly 6 minutes, and that people find out whether or not they will be approved instantaneously. I really don't think you could ask for much more than that. And a reminder that you can find our our PowerPoint slide decks, mine, but more importantly, Audrey and Joan's, in that handout section of your GoToWebinar control panel, where you'll also find some other information, important information about the PAN Foundation. I do see some questions coming in, which is a great opportunity for me to remind you that you can submit questions by typing them into that questions section of your GoToWebinar control panel. And as those questions come in, I want to remind you also that NeedyMeds is here as well as a source of healthcare savings resources. What you're looking at on our screen are all of the healthcare savings resources you can find under that patient savings tab that I pointed out in the beginning of the presentation on NeedyMeds.org. So please do check it out, and don't hesitate to reach out to our call center counselors if you're looking for help affording a particular medication or healthcare cost. Also, I do hope you join us for future upcoming webinars. There's a snapshot of the ones coming up next month. We do stay busy here at NeedyMeds, and we hope you find the topics of our webinars enticing to you. And again, you can sign up for those webinars and read more about what they'll actually entail on the bottom right hand of NeedyMeds.org on our calendar of events. I want to leave up the contact information for myself and NeedyMeds at the bottom, but more importantly for Audrey and Joan and the PAN Foundation on your screen there. So again, don't hesitate to reach out to them if you do have questions. And a reminder that we're going to do our best to get to some of the questions coming in, but we won't have a chance to get to all of them. If we don't answer yours, we will follow up with you via email, but don't hesitate to reach out to the PAN Foundation call center or to NeedyMeds. So Audrey and Joan, thanks for that great presentation. And a big thank you to the PAN Foundation for everything they do to help the underinsured. One of the questions coming in, and this is a question I'll probably answer as well, is what has I'll ask you to answer it for PAN Foundation, but I'll also answer it for NeedyMeds. The question is, what has PAN been doing in response to COVID?
Great question. Thank you so much, Carla, and thank you for asking that question for the audience member that asked it. So for COVID-19, we do recognize that it has brought a lot of hardship to most of our patients, and it's impacted their financial situation in a big way. And so what we've tried to do here at PAN and what we continue to do is to look for ways that we can possibly support these patients. And one of the ways that we try to do that is to open a COVID-19 financial support program. It provides about $300 in financial assistance to help our patients pay for anything from treatment expenses for COVID-19, over-the-counter or prescription medication. It also includes delivery of that medication, and also like medical equipment, supplies, transportation, groceries, and even meals, including deliveries as well. So we try to expand that so that patients can use that financial resource for the things that they really need at the moment in time. And to qualify for this program, the patient must be diagnosed with COVID-19 or be directed to self-quarantine by their healthcare provider or government agencies, which most of us fall under that category because of social distancing that we are trying to not be not in close proximity as people, especially those that are vulnerable. We try not to be too much of close proximity to them. In addition to that, the patient must have a chronic rare disease or cancer. So basically just looking at our landscape of patients, and it doesn't necessarily have to be a disease that is on our list of disease fund, but they have to have one of these diagnoses. And among other qualifications, which is also all listed on our website. But to check out for a full listing and to get more information on that, you can visit our website at panfoundation.org. And I'll turn it over to you, Carla.
Thank you so much. Yeah, thank you so much, and thank you for the question. And I'm glad we had an opportunity to ask Audrey and Joan about that, because it's a great example of what I was saying before, that the PAN Foundation is constantly evolving and expanding to meet the population they serve, to meet their needs. As I said, I wanted to also answer that question for NeedyMeds. Under that patient savings tab on NeedyMeds.org, right in the center, you will find a new category. It's the COVID-19 Resource Center, and we set that up a few months ago, and it is to help those that have been impacted and need assistance with either because they're struggling with financial issues, or because they're experiencing difficulty affording their health care through the pandemic. So do check out that COVID-19 Resource Center under NeedyMeds.org, the Patient Savings tab. Another question coming in is, does PAN cover vaccinations or diagnostic tests? And I bet you get that question quite a bit.
We definitely do. So unfortunately, PAN currently does not cover doctor's visits, lab work, genetic testing, vaccinations, or ER visits, or diagnostic testing. But we do cover prescription medication copays for all of our assistance programs. We have a few disease funds that cover medical devices and other services that are used for administering treatments. So please visit our website at panfoundation.org to see the full listing of what we offer in terms of programs in our formulary. In addition, we mentioned earlier that we do have a few premium assistance programs, as well as the travel assistance programs, with a new updated travel program coming later in the fall.
Thank you so much for that thorough answer and for the question. And we're going to wrap it up with one final question. And again, for those of you that we didn't get a chance to answer your question, we will follow up with you via email. So we're going to wrap it up with this last question, which is, what can I do if my medication is not covered?
Yes, that's also a great question. So on our website, under Find a Disease Fund, is where you can really check to see if your medication is covered. You can type it into the search box, or if you know the disease fund that you're looking for, you can click on the assistance page directly related to the disease fund. On those pages, you'll see a full formulary of what we cover under that fund. Now, if you don't see your medication covered, you can click the button Contact Us on that page, which then allows you to send a message to us, and you can provide your medication and your diagnosis for PAN to review. You can also call us at 866-316-7263 to submit your request that way as well. PAN will take that medication request and review it to see if it's compliant and follows our formulary policy. Then we'll make a decision, and we'll be able to follow up with you on your request. But please allow around 7 business days for PAN to do the research.
Thank you so much. And I will remind everybody that also NeedyMeds is here as a source of support if you're having difficulty affording your medications and other healthcare expenses. So as I said, we're going to keep the question segment brief. We will get back in touch with you if we didn't get a chance to answer your question, but don't hesitate to reach out to the PAN Foundation call center or the NeedyMeds call center as well. With that, I want to thank everybody for taking time out of their busy schedule to learn more about the PAN Foundation and NeedyMeds. And thank you to our partners, Audrey and Joan at the PAN Foundation. Thanks, everybody. Stay in touch and have a great rest of the day. Take care.
Thank you so much, Carla, and thank you once again, everyone. And thank you, Joan.
Thank you, everyone. Have a good day.